Welcome to Part 9 of our 862-question NCLEX-RN 2026 practice series. In this video, you'll complete questions 551 to 650 with NCLEX-style practice questions and detailed explanations designed to strengthen your clinical judgment and nursing knowledge. Like, subscribe, and turn on notifications to follow the complete 862-question NCLEX-RN 2026 series and continue preparing with us. Question 551. A client has renal failure. Today's lab values indicate he has an elevated serum potassium. What additional priority information does the nurse need to obtain? A. Evaluation of his level of consciousness. B. Evaluation of an electrocardiogram. C. Measurement of his urine output for the past 8 hours. D. Serum potassium lab values for the last several days. Answer: B. Evaluation of an electrocardiogram. Explanation: A. The level of consciousness is not affected by elevated potassium levels. B. An electrocardiogram (EKG) can tell the nurse whether this client is experiencing any cardiac dysfunction or arrhythmias related to the elevated potassium level. C. Measurement of the urine output is not a priority nursing action at this time. D. The client's serum potassium values for the past several days may provide information about his renal function, but they are not a priority at this time. Question 552. A 20-year-old client presents to the obstetrics gynecology clinic for the first time. She tells the nurse that she is pregnant and wants to start prenatal care. After collecting some initial assessment data, the nurse measures her fundal height to be at the level of the umbilicus. The nurse estimates the fetal gestational age to be approximately A. 10 weeks, B. 16 weeks, C. 20 weeks, D. 30 weeks. Answer: C. 20 weeks. Explanation: A. At 10 weeks, the fundus is located slightly above the symphysis pubis. B. At 16 weeks, the fundus is halfway between the symphysis pubis and the umbilicus. C. At 20 weeks, the fundus is located approximately at the umbilicus. D. At 30 weeks, the fundal height is about 30 centimeters, or 10 centimeters above the umbilicus. Question 553. A male client is undergoing cardiac tests. He has been instructed to wear a Holter monitor. The nurse knows she has included the appropriate information in her teaching when the client tells her: A. He should remove the electrodes for bathing. B. Damage to his heart muscle will be recorded by the monitor. C. He is to keep a record of everything he does during the day. D. He is to refrain from activities that cause chest pain. Answer: C. He is to keep a record of everything he does during the day. Explanation: A. The client should leave the electrodes in place during the entire time the test is ordered. He should not even remove the electrodes for bathing. B. The Holter monitor will record cardiac electrical activity but will not record damage to his myocardium. C. The client should keep a record of all of his activities so the physician can correlate the ECG findings with his activities. D. The client should continue doing his regular activities. The purpose of the Holter monitor is to record heart activity during routine activities. Question 554. A client who is gravida 1 para 1 vaginally delivered a 7 lb girl. She received a midline episiotomy at delivery. When assessing the level of her uterus immediately following delivery, the nurse would expect the fundus to be located: A. At the umbilicus. B. At the symphysis pubis. C. Midway between the umbilicus and the xiphoid process. D. Midway between the umbilicus and the symphysis pubis. Answer: D. Midway between the umbilicus and the symphysis pubis. Explanation: A. Within 12 hours of delivery, the fundus of the uterus rises to, or slightly above or below, the umbilicus. Fundal height generally decreases 1 finger breadth, or 1 centimeter per day. B. The uterus descends into the pelvic cavity at approximately 1012 postpartal days and can no longer be palpated abdominally. C. Within 12 hours of delivery, the fundus of the uterus rises to, or slightly above or below, the umbilicus. Fundal height generally decreases 1 finger breadth, or 1 centimeter per day. An enlarged uterus may indicate subinvolution or postpartal hemorrhage. D. Immediately following delivery, the uterus lies midline, about midway between the umbilicus and the symphysis pubis. Question 555. A female client was employed as a client care technician in a hemodialysis unit. She recently began to experience extreme fatigue, being able to sleep for 1,620 hours at a time. She also noted that her urine was tea-colored, which she rationalized was a result of the vitamins she began taking to alleviate fatigue. She was diagnosed with hepatitis B. After a brief hospital stay, she is discharged to her parents' home. Her mother asks the nurse if any precautions are necessary to prevent transmission to the client's family. The nurse explains necessary precautions, which include A. Isolation of the client from the remainder of the family. B. Separate bathroom facilities if possible, if not, then cleansing daily of the facilities with a chloride solution. C. No necessary precautions because she is beyond the contagious phase. D. Laundering clothes separately in cold water with a chloride solution. Answer: B. Separate bathroom facilities if possible, if not, then cleansing daily of the facilities with a chloride solution. Explanation: A. Isolation is not necessary, even in the acute phase. B. Separate bathroom facilities are recommended. If unavailable, daily cleansing with a chloride solution is recommended. C. Precautions continue to be necessary while the client is in the active phase of hepatitis. D. Clothes are to be laundered separately in hot water with a chloride solution. Question 556. A female client presents to the obstetric gynecology clinic for a pregnancy test, the result which turns out to be positive. Her last menstrual period began December 10, 1993. Using Geely's rule, the nurse estimates her date of delivery to be A. September 17, 1994. B. September 10, 1994. C. September 3, 1994. D. August 17, 1994. Answer: A. September 17, 1994. Explanation: A. According to Geely's rule, the estimated date of delivery is calculated by adding 7 days to the date of the first day of the normal menstrual period, December 10 plus 7 days equals December 17, and then by counting back 3 months, December 17 to 3rd MO equals September 17. B, C, D, these answers are incorrect. Question 557. A female client at 30 weeks gestation is brought into the emergency department after falling down a flight of stairs. On examination, the physician notes a rigid, board-like abdomen, FHR in the 160s, and stable vital signs. Considering possible abdominal trauma, which obstetric emergency must be anticipated? A. Abruptio placentae. B. Ectopic pregnancy. C. Massive uterine rupture. D. Placenta previa. Answer: A. Abruptio placentae. Explanation: A. Abruptio placentae, the complete or partial separation of the placenta from the uterine wall, can be caused by external trauma. When hemorrhage is concealed, one sign is a rapid increase in uterine size with rigidity. B. Ectopic pregnancy occurs when the embryo implants itself outside the uterine cavity. C. Massive uterine rupture occurs during labor when the uterine contents are extruded through the uterine wall. It is usually due to weakness from a pre-existing uterine scar and trauma from instruments or an obstetrical intervention. D. Placenta previa is the condition in which the placenta is implanted in the lower uterine segment and either completely or partially covers the cervical os. Question 558. A female client is concerned that she is in a high-risk group for the development of acquired immunodeficiency syndrome, AIDS. She wants to know about the advisability of donating blood. Which of the following responses is correct? A. Individuals who donate blood are at risk of getting the AIDS virus. You should not donate. B. It's okay for you to donate because the blood bank has a test that is 100% effective. C. You should not donate since it takes time to develop antibodies to the AIDS virus. If you donate blood before you develop the antibody, you could pass it on in the blood. D. It is not a good idea for you to donate. If you have AIDS, the information is made public and could destroy your personal life. Answer: C. You should not donate since it takes time to develop antibodies to the AIDS virus. If you donate blood before you develop the antibody, you could pass it on in the blood. Explanation: A. The AIDS virus cannot be transmitted to the donor through the blood donation procedure. B. The test for the AIDS virus is not absolutely foolproof, therefore, it is not wise for a person with known risk factors to donate blood. C. It takes time for antibodies to the AIDS virus to develop. An infected individual could donate contaminated blood without it testing positive for the virus. D. For reasons of confidentiality, information about individuals infected with AIDS is not made public. Question 559. A client's wife is concerned over his behavior in recent months. He has been diagnosed with Parkinson's disease, and she is telling his nurse that he has been doing strange things. The nurse reassures the wife that the following behavior is normal with Parkinson's disease. A. Your husband will experience some periods of muscle flaccidity. Be sure to make him sit down during these periods. B. Your husband may move his hands in motions that look like he is rolling a pill between his fingers. C. Twitching of the muscles is to be expected and can occur at any time during the day. D. Parkinson's disease causes severe pain in the joints. You should give your husband Tylenol at those times. Answer: B. Your husband may move his hands in motions that look like he is rolling a pill between his fingers. Explanation: A. Clients with Parkinson's disease generally experience stiffness and rigid movement. B. Pill-rolling movements are a symptom experienced by the Parkinson client. C. Twitching of the muscles is not an expected symptom of Parkinson's disease. D. Parkinson's disease does not cause joint pain. Mild muscular pain may be present. Question 560. A female client plans to bottle feed her newborn. Her physician has ordered bromocriptine, Perladel, to suppress lactation. Which of the following instructions about bromocriptine should be given by the nurse? A. Bromocriptine stimulates the production of prolactin. B. Hypertension is a primary side effect. C. Bromocriptine is generally taken for 5 days. D. Her blood pressure must be stable before starting bromocriptine. Answer: D. Her blood pressure must be stable before starting bromocriptine. Explanation: A. Bromocriptine inhibits the secretion of prolactin. B. Hypotension is a side effect of this drug, hypertension is not. C. Bromocriptine is generally taken for 14 days. D. The administration of bromocriptine is delayed at least 4 hours postpartum and given only when the client's blood pressure is stable, because it can cause hypotension and syncope. Question 561. A young child has been placed in a spica cast. The chief concern of the nurse during the first few hours is A. Prevention of neurovascular complications. B. Prevention of loss of muscle tone. C. Immobilization of the affected limb. D. Using heated fans to dry the cast. Answer: A. Prevention of neurovascular complications. Explanation: A. Because the extremity may continue to swell and the cast could constrict circulation, the nurse should elevate the limb and observe for capillary refill, warmth, mobility of toes and circulation. B. Although muscle tone may diminish over time in the affected limb, this is not the immediate concern. C. The limb has been immobilized already by the cast, and therefore immobilization is not a concern. D. Heated fans and dryers are discouraged because the outside cast will dry quickly, yet the area beneath the cast remains wet and could cause burns. Question 562. A female client at 10 weeks gestation complains to her physician of slight vaginal bleeding and mild cramps. On examination, her physician determines that her cervix is closed. The client is exhibiting signs of A. An inevitable abortion. B. A threatened abortion. C. An incomplete abortion. D. A missed abortion. Answer: B. A threatened abortion. Explanation: A. An inevitable abortion includes the signs of cervical dilation and effacement as well as pain and bleeding. B. A threatened abortion is a condition in which intrauterine bleeding occurs early in pregnancy, the cervix remains undilated, and the uterine contents are not necessarily expelled. C. An incomplete abortion occurs when some portions of the products of conception are expelled from the uterus. D. A missed abortion occurs when the embryo dies in utero and is retained in the uterus. Question 563. The FHR pattern in a laboring client begins to show early decelerations. The nurse would respond by A. Notifying the physician. B. Changing the client to the left lateral position. C. Continuing to monitor the FHR closely. D. Administering O2 at 8 liters per minute via face mask. Answer: C. Continuing to monitor the FHR closely. Explanation: A. Early decelerations are reassuring and do not warrant notification of the physician. B. Because early decelerations is a reassuring pattern, it would not be necessary to change the client's position. C. Early decelerations warrant the continuation of close FHR monitoring to distinguish them from more ominous signs. D. O2 is not warranted in this situation, but it is warranted in situations involving variable and/or late decelerations. Question 564. Which behavior by a female client feeding her newborn demonstrates that she needs more teaching related to safety and infant feeding? A. She uses the bulb syringe to help clear her baby's nose when milk is regurgitated. B. She places her infant on her right side after feeding her. C. She props the bottle in the crib to feed her baby, which allows her to write birth announcements and feed her baby at the same time. D. She burps her baby by placing her in a sitting position, supporting her head and neck and gently massaging her back. Answer: C. She props the bottle in the crib to feed her baby, which allows her to write birth announcements and feed her baby at the same time. Explanation: A. This practice is the proper use of the bulb syringe to clear the infant's airway in case of regurgitation. B. Placing the infant on either side or on the stomach prevents aspiration of regurgitated milk. C. Bottle propping is an unsafe practice because it increases the likelihood of aspiration. D. This practice is one correct way of burping an infant. Question 565. A 45-year-old male client experiences a sense of depression because he has not yet achieved his life's goals. His career has not been satisfying. He is still looking for the right job. His wife spends too much money, and his children seem to ignore him while being very selfish. He is tired of all of their attitudes and is considering buying a red Corvette convertible. While obtaining these data concerning the client's feelings about his life, the nurse is able to determine he is experiencing what psychological crisis according to Erikson's stages? A. Identity versus role confusion. B. Integrity versus despair. C. Intimacy versus isolation. D. Generativity versus self-absorption. Answer: D. Generativity versus self-absorption. Explanation: A. Identity versus role confusion is experienced by adolescents making the transition from childhood to adulthood as they attempt to develop a sense of identity. B. Integrity versus despair is experienced by the elderly as they reflect on their life in an attempt to find meaning. C. Intimacy versus isolation is experienced by young adults as they establish intimate bonds of love and friendship. D. Generativity versus self-absorption is experienced by middle-aged adults as they fulfill life goals that involve family, career, and society. The client is experiencing this crisis. Question 566. The pediatrician has diagnosed tinea capitis in an 8-year-old girl and has placed her on oral griseofulvin. The nurse should emphasize which of these instructions to the mother and her child? A. Administer oral griseofulvin on an empty stomach for best results. B. Discontinue drug therapy if food tastes funny. C. May discontinue medication when the child experiences symptomatic relief. D. Observe for headaches, dizziness, and anorexia. Answer: D. Observe for headaches, dizziness, and anorexia. Explanation: A. Giving the drug with or after meals may allay gastrointestinal discomfort. Giving the drug with a fatty meal, ice cream or milk, increases absorption rate. B. Griseofulvin may alter taste sensations and thereby decrease the appetite. Monitoring of food intake is important, and inadequate nutrient intake should be reported to the physician. C. The child may experience symptomatic relief after 48-96 hours of therapy. It is important to stress continuing the drug therapy to prevent relapse, usually about 6 weeks. D. The incidence of side effects is low, however, headaches are common. Nausea, vomiting, diarrhea, and anorexia may occur. Dizziness, although uncommon, should be reported to the physician. Question 567. The postpartum nurse should include which of the following instructions to breastfeeding mothers? A. Limit feeding times for several days to avoid nipple soreness. B. Wash the nipples with soap and water before and after each feeding. C. Daily caloric intake should be increased by 500 calories. D. Breast milk is totally digestible by the baby because it contains lactose. Answer: C. Daily caloric intake should be increased by 500 calories. Explanation: A. Limiting initial feeding times will only delay nipple soreness as well as the establishment of the letdown reflex, thus encouraging engorgement from clogged ducts and ductholes. B. Soap should be avoided because it may be excessively drying, predisposing nipples to cracking. C. For optimal milk production, an additional 500 kilocalories over maintenance levels are needed daily. D. Lipase, not lactose, emulsifies the fat in breast milk, making it almost totally digestible by infants. Question 568. A male client is being treated in the burn unit for third-degree burns on his head, neck, and upper chest received in the last 24 hours. The nurse is evaluating the effectiveness of fluid resuscitation. Which of the following indicates effective fluid balance? A. His weight increases from 165 to 175 pounds. B. His urine output is equal to his total fluid intake. C. His urine output has been 35 ml/hr for the past 12 hours. D. His blood pressure is 94/60. Answer: C. His urine output has been 35 ml/hr for the past 12 hours. Explanation: A weight gain of 10 pounds represents a state of overhydration. B. He is losing fluids through insensible losses. A urine output equal to his intake indicates that he is receiving too little fluids. C. A urine output greater than his intake indicates that he is receiving adequate fluid resuscitation to account for urinary and insensible losses. D. A blood pressure of 94/62 indicates a state of underhydration and inadequate circulatory volume. Question 569. An 82-year-old former restaurant owner walks to the nursing station and states, "I have to go." The restaurant opens at 11 a.m. Which response by the nurse is the most appropriate? A. Go back to your room. You do not own a restaurant. B. You are in the hospital now. Calm down. C. You once owned a restaurant. Tell me about it. D. It is snowing outside. The restaurant is closed. Answer: C. You once owned a restaurant. Tell me about it. Explanation: A. This response cuts off communication with the client. It does not address her feelings. B. Reality orientation frequently does not work alone. Feelings must be addressed. Telling a client to calm down is frequently ineffective. C. Reminiscence is used here to reorient and recall past pleasant events. Talking about the restaurant will allay anxiety. D. This response may confirm to the client that she indeed does still own a restaurant, buying into her confusion. Her feelings and anxiety require nursing intervention. Question 570. A 10-year-old boy has been diagnosed with Legg-Calvé-Perthes disease. Which of the client's responses would indicate compliance during initial therapy? A. Drinking large amounts of milk. B. Not bearing weight on affected extremity. C. Walking short distances 3 times/day. D. Putting self on weight reduction diet. Answer: B. Not bearing weight on affected extremity. Explanation: A. This condition causes a septic necrosis of the head of the femur in the acetabulum. Drinking large quantities of milk at this time cannot hasten recovery. B. The aim of treatment is to keep the head of the femur in the acetabulum. Non-weight bearing is essential. Activity causes microfractures of the epiphysis. C. In addition to non-weight bearing, clients are often placed on bed rest, which helps to reduce inflammation. Later, active motion is encouraged. D. Weight is not generally an issue with this disease. Slipped femoral capital epiphysis, which is most frequently observed in obese pubescent children, usually requires a weight reduction diet. Question 571. A female client is seeking counseling for personal problems. She admits to being very unhappy lately at both home and work. During the nursing assessment, she uses many defense mechanisms. Which statement or action made by the client is an example of adaptive suppression? A. I did not get the raise because my boss does not like me. B. I felt a lump in my breast 2 weeks ago. I put off getting it checked until after my sister's wedding. C. My son died 3 years ago. I still cannot bring myself to clean out his room. D. My husband told me this morning that he wants a divorce. I am upset, but I cannot discuss the matter with him until after my company's board meeting today. Answer: D. My husband told me this morning that he wants a divorce. I am upset, but I cannot discuss the matter with him until after my company's board meeting today. Explanation: A. This statement is an example of adaptive rationalization. She is coping with her disappointment by rationalizing. This is adaptive because no harm is done to self or others. It is used to protect her ego. B. This is an example of maladaptive suppression. She is suppressing the seriousness of the lump. It is maladaptive because delaying treatment will cause harm to her. C. The client's actions are an example of maladaptive denial. She is denying her son's death by not facing his possessions. Until she faces his death, she cannot face reality. D. This is an example of adaptive suppression. She realizes the impact of her husband's statement but delays discussion until she can devote her full attention to the matter. Question 572. A 15-year-old child is admitted to the pediatric unit with a diagnosis of thalassemia. Which of the following would be included in educating the mother and child as part of discharge planning? A. Give oral iron medication every day. B. Have the child's blood pressure monitored every week. C. Know the signs and symptoms of iron overload. D. Keep exercise at a minimum to reduce stress. Answer: C. Know the signs and symptoms of iron overload. Explanation: A. Oral iron supplements are contraindicated in thalassemia. B. Although heart failure may be an end result of this disease, this action is unnecessary. C. Iron overload is a potential complication of frequent blood transfusions of children with thalassemia. D. Children should be encouraged to pursue activities related to their exercise tolerance. Question 573. A female client comes for her second prenatal visit. The nurse midwife tells her, "Your blood tests reveal that you do not show immunity to the German measles." Which notation will the nurse include in her plan of care for the client? Will need: A. Rh immune globulin at the next visit. B. Rh immune globulin within 3 days of delivery. C. Rubella vaccine at the next visit. D. Rubella vaccine after delivery on the day of discharge. Answer: D. Rubella vaccine after delivery on the day of discharge. Explanation: A. Rh immune globulin is given to Rh-negative mothers to prevent the maternal Rh immune response. B. Rh immune globulin is given to Rh-negative mothers to prevent the maternal Rh immune response. C. The rubella vaccine is not given during pregnancy because of its teratogenicity. D. Non-immune mothers are vaccinated early in the postpartum period to prevent future infection with the rubella virus. Question 574. A 30-year-old female client is receiving antineoplastic chemotherapy. Which of the following symptoms should especially concern the nurse when caring for her? A. Respiratory rate of 16 breaths/min. B. Pulse rate of 80 bpm. C. Complaints of muscle aches. D. A sore throat. Answer: D. A sore throat. Explanation: A. A respiratory rate of 16 breaths/min is normal and is not a cause for alarm. B. A pulse rate of 80 bpm is normal and is not a cause for alarm. C. Complaints of muscle aches are unrelated to her receiving chemotherapy. There may be other causes related to her hospital stay or the disease process. D. A sore throat is an indication of a possible infection. A client receiving chemotherapy is at risk of neutropenia. An infection in the presence of neutropenia can result in a life-threatening situation. Question 575. A 50-year-old male client is to receive chemotherapy. The physician's orders include antiemetics. When planning his care, the nurse should take into consideration that antiemetics are best administered in the following way. A. Give antiemetics when nausea is experienced and continue on a regular schedule for 1,224 hours. B. Give antiemetics prior to the client receiving chemotherapy and continue on a regular basis for at least 2,448 hours after chemotherapy. C. Give antiemetics one at a time because combinations of antiemetics cause overwhelming side effects. D. Give antiemetics intermittently during the entire course of chemotherapy. Answer: B. Give antiemetics prior to the client receiving chemotherapy and continue on a regular basis for at least 2,448 hours after chemotherapy. Explanation: A. Nausea is more difficult to control if antiemetics are withheld until nausea is experienced. B. Antiemetics should be given prophylactically at the beginning of chemotherapy and continued on an around-the-clock basis to prevent nausea. C. Combinations of antiemetics give the best control for nausea by blocking various causes of nausea induced by chemotherapy. D. Antiemetics should be given around the clock during the course of chemotherapy. This prevents nausea from developing and prevents anticipatory nausea during subsequent chemotherapy administrations. Question 576. A male infant is to be discharged home this morning. Which instruction related to his cord care should be included in his mother's discharge teaching plan? A. Keep the umbilical area moist with Vaseline until the stump falls off. B. Keep the umbilical area covered at all times with the diaper. C. Clean the umbilical cord with alcohol at each diaper change. D. Clean the umbilical cord daily with soap and water during the bath. Answer: C. Clean the umbilical cord with alcohol at each diaper change. Explanation: A. The umbilical area should be kept dry for healing to occur. Moisture is conducive to bacterial growth and therefore could lead to infection at the site. B. The diaper should be folded below the cord to allow the cord stump to be exposed to the air for healing. C. The umbilical cord should be swabbed with alcohol at each diaper change to remove urine and stool and to facilitate the desiccation process through drying. D. Soap and water should not be used to clean the umbilical area because the area could retain moisture, thus making it susceptible to bacterial growth and infection. Question 577. A client has just received an epidural block. She is laboring on her right side. The nurse notes that her blood pressure has dropped from 132/68 to 78/42 mmHg. The nurse's first action would be to A. Call the physician immediately and give dopamine IM. B. Turn her on her left side and recheck her blood pressure in 5 minutes. C. Administer oxytocin, pitocin, immediately and increase the rate of 4 fluids. D. Increase the rate of 4 fluids and start O2 by mask. Answer: D. Increase the rate of 4 fluids and start O2 by mask. Explanation: A. Nursing measures to support fetal oxygenation and promote maternal blood pressure would precede calling the physician. B. Systolic pressures below 100 mm of mercury or a reduction in the systolic pressure of NGT, 30% necessitate treatment. Assessing the blood pressure in 5 minutes may allow for further fetal and/or maternal compromise. Turning the client on her left side will promote uteroplacental perfusion and is appropriate. C. Oxytocin, pitocin, increases the strength of uterine contractions and may cause maternal hypotension, thus it is an inappropriate drug for use in this clinical situation. 4 fluids would be increased to expand the circulating blood volume and promote increased blood pressure. D. Turning the mother to her left lateral side promotes uteroplacental perfusion. 4 fluids are administered to increase the circulating blood volume, and O2 is administered to promote fetal oxygenation and decrease the nausea accompanying the hypotension. Question 578. To prevent thrombophlebitis in a client on complete bed rest, the nursing care plan should include A. Dangle the client's legs over the edge of the bed every shift. B. Massage the client's calves briskly every shift. C. Keep the client's legs extended and discourage any movement. D. Have the client tighten and relax leg muscles several times daily. Answer: D. Have the client tighten and relax leg muscles several times daily. Explanation: A. Dangling the client's legs over the edge of the bed will contribute to stasis and pooling of blood and increases the risk of thrombus formation. B. Massaging the client's calves could result in dislodging an embolus. C. Decreased movement will contribute to pooling of blood and increased risk of venous thrombosis. D. Tightening and relaxing leg muscles increases circulation and decreases the risk of venous thrombosis. Question 579. A 10-year-old has been diagnosed with acute post-streptococcal glomerulonephritis. The clinical findings were proteinuria, moderately elevated blood pressure, and periorbital edema. Which dietary plan is most appropriate for this client? A. Low-protein diet. B. Low-sodium diet. C. Increased fluid intake. D. High cholesterol diet. Answer: B. Low-sodium diet. Explanation: A high-protein diet is usually indicated because protein is excreted in urine. Protein restriction is usually prescribed with severe azotemia. B. The kidneys usually enlarge in these children, and sodium and water are retained. C. Fluid restriction may be ordered to help reduce edema, however, monitoring for dehydration is indicated. D. A high cholesterol diet would not be indicated for any child, especially one with elevated blood pressure. Question 580. At 12 hours post-vaginal delivery, a female client is without complications. Which of the following assessment findings would warrant further nursing interventions? A. Apical pulse of 52 bpm. B. Uterine fundus palpable left of midline. C. No bowel movement since delivery. D. Oral temperature of 100.4 F. Answer: B. Uterine fundus palpable left of midline. Explanation: A. Bradycardia of 5070 bpm may be considered normal postpartally because the heart compensates for the decreased resistance in the pelvis. B. The uterus is displaced from the midline by a full bladder. This condition could lead to a boggy uterus and increased risk of postpartal hemorrhage, therefore, the bladder should be kept empty. C. Re-establishment of normal bowel function is delayed into the first postpartum week. D. A postpartum woman's oral temperature may go as high as 100.4 F within 24 hours of delivery resulting from muscular exertion, dehydration, and hormonal changes. Question 581. A 28-year-old client comes to the clinic for her first prenatal examination. In relating her obstetrical history, she tells the nurse that she has been pregnant twice before. She had a miscarriage with the first pregnancy after 6 weeks. With the second pregnancy, she delivered twin girls at 31 weeks gestation. One of the twins was stillborn and the other twin died at 4 days of age. Using a 5-digit system, the nurse records her as being A 2-0-2-1-0, B 2-2-2-1-2, C 3-0-1-1-0, D 2-1-1-0-0. Answer: C 3-0-1-1-0. Explanation: A. The first digit represents the total number of pregnancies. This client has been pregnant 3 times including this pregnancy. The twin pregnancy counts as only one pregnancy, and because she delivered prior to 37 weeks gestation, the third digit is recorded as 1. B. The first digit represents the total number of pregnancies. This client has been pregnant 3 times including this pregnancy. The second digit represents the total number of full-term deliveries. She has lost 2 pregnancies before 37 weeks gestation. At present, she has no living children, so the 5th digit is noted as 0. C. The client is pregnant for the 3rd time, and the first digit reflects the total number of pregnancies. She has had no full-term deliveries, because she delivered prior to 37 gestational weeks, so the 2nd digit is recorded as 0. The 3rd digit represents the number of preterm deliveries, and a twin pregnancy counts as only one delivery. She lost an earlier pregnancy prior to 20 gestational weeks, and the 4th digit reflects spontaneous or elective abortions. Lastly, the fifth digit indicates the number of children currently living, and she has no living children. D. She is pregnant for the third time, and the first digit reflects the total number of pregnancies. In the previous 2 pregnancies, she delivered prior to 37 gestational weeks, thus having no full-term deliveries, which is indicated by the second digit. The fourth digit represents the total number of abortions, spontaneous or elective, and she reported a spontaneous abortion with her first pregnancy. Question 582. The nurse observes a client crying quietly. She has just experienced a spontaneous abortion at 9 weeks gestation. An appropriate response by the nurse would be: A. It must be God's will and probably is for the best. B. This must be a difficult time for you. Would you like to talk about it? C. I'm sure your other children will be a comfort for you. D. Don't worry, you're still young. If I were you, I'd just try again. Answer: B. This must be a difficult time for you. Would you like to talk about it? Explanation: A. This response is non-therapeutic because it belittles the client's response and gives a meaningless rationalization. B. This response acknowledges the client's feelings and demonstrates the therapeutic offering of self by the nurse. C. This response is non-therapeutic because it does not focus on the client's feelings and offers false reassurance. D. This response is non-therapeutic because it belittles the client's feelings and offers her advice. Question 583. A female client has been diagnosed with chronic renal failure. She is a candidate for either peritoneal dialysis or hemodialysis and must make a choice between the two. Which information should the nurse give her to help her decide? A. Hemodialysis involves less time to filter the blood, but the client must consider travel time, distance, and inconvenience. B. Hemodialysis involves more time to filter the blood than does peritoneal dialysis. C. Peritoneal dialysis has almost no complications and is less time-consuming than hemodialysis. Therefore it is preferred. D. Peritoneal dialysis requires that a home health nurse prepare and administer the treatments. Answer: A. Hemodialysis involves less time to filter the blood, but the client must consider travel time, distance, and inconvenience. Explanation: A. Hemodialysis is faster in clearing the blood of toxins than peritoneal dialysis. However, clients must consider the time that they spend traveling to the dialysis center and the disruption in their daily lives. B. Peritoneal dialysis requires several exchanges with dwelling time for the dialysate and therefore takes longer than hemodialysis. C. Several serious complications of peritoneal dialysis include peritonitis, catheter displacement and/or plugging, or pain during dialysis. D. A client can be taught to self-administer peritoneal dialysis without the aid of a professional. Question 584. At her monthly prenatal visit, a client reports experiencing heartburn. Which nursing measure should be included in her plan of care to help alleviate it? A. Restrict fluid intake. B. Use Alka-Seltzer as necessary. C. Eat small, frequent bland meals. D. Lie down after eating. Answer: C. Eat small, frequent bland meals. Explanation: A. At least 8 glasses of fluid per day are encouraged to help dilute stomach contents, thereby decreasing irritation. B. Alka-Seltzer contains aspirin, which is irritating to gastric mucosa, and therefore should be avoided. C. Small, frequent bland meals help to decrease gastric pressure and to prevent reflux. D. Lying down after meals may cause gastric reflux and prevents optimal gastric emptying. Question 585. A female client was recently diagnosed with gastric cancer. She entered the hospital and had a total gastrectomy with esophagojejunectomy. Her postoperative recovery was uneventful. On conducting discharge teaching, The nurse discusses changes in bodily function and lifestyle changes with the client. In order to prevent pernicious anemia, the nurse stresses that the client must A. Receive monthly blood transfusions. B. Increase the amount of iron in her diet. C. Eat small quantities several times daily until she is able to tolerate food in moderate portions. D. Understand the need for vitamin B12 replacement therapy. Answer: D. Understand the need for vitamin B12 replacement therapy. Explanation: A. Monthly blood transfusions are not indicated post-gastrectomy. B. Increasing iron in the client's diet may cause irritation and will not alleviate pernicious anemia. C. It may be necessary that the client eat small meals several times per day, but this measure has no relevance to prevention of pernicious anemia. D. Pernicious anemia is caused by lack of vitamin B12, and replacement therapy will be necessary because the client's stomach has been removed. Question 586. 7 days ago, a 45-year-old female client had an ileostomy. She is self-sufficient and well otherwise. Which of the following long-term objectives would be unrealistic? A. She should be able to control evacuation of her bowels. B. She should be able to return to a regular diet. C. She should be able to resume sexual activity. D. She should be able to manage her own care. Answer: A. She should be able to control evacuation of her bowels. Explanation: A. Because of the location of an ileostomy, the client will not be able to control the evacuation of her bowels. The ileostomy will drain liquid stool continuously. B. The client should be able to return to a normal, well-balanced diet. She should avoid foods that cause diarrhea or excessive gas production, and she should eat small meals. C. The client should be able to resume sexual activity. She will be able to wear a pouch. D. The client has no other health or mental problems and should be able to manage her own ileostomy. Question 587. As a nurse in the emergency room, you receive an outside call from an elderly woman who states she has just been raped. She states, "I know I must come to the hospital, but what do I do next?" You advise her to call the police, then come to the hospital emergency room. What action by the nurse would indicate an understanding of the examination process once the victim enters the emergency room? A. Inform the victim not to wash, change clothes, douche, brush teeth, or eat or drink anything. B. Inform the victim to bring insurance information with her to the hospital so she can be properly cared for. C. Phone a rape counselor to begin working with the victim as soon as she enters the hospital. D. Do not leave the victim alone to collect her thoughts. Answer: A. Inform the victim not to wash, change clothes, douche, brush teeth, or eat or drink anything. Explanation: A. Providing the victim with these instructions will aid in the determination of physical evidence of rape. Victims frequently feel dirty after rape, and their first instinct is to take care of personal hygiene before facing anyone. B. This action is of lesser importance at this time. C. Although this is a nursing measure appropriate in this situation, contacting a counselor can be done once the victim enters the hospital. Frequently victims call but do not follow up with the visit. D. Once the victim enters the emergency room, it is important not to leave her alone. Question 588. A male client is experiencing extreme distress. He begins to pace up and down the corridor. What nursing intervention is appropriate when communicating with the pacing client? A. Ask him to sit down. Speak slowly and use short, simple sentences. B. Help him to recognize his anxiety. C. Walk with him as he paces. D. Increase the level of his supervision. Answer: C. Walk with him as he paces. Explanation: A. The nurse should not ask him to sit down. Pacing is the activity he has chosen to deal with his anxiety. The nurse dealing with this client should speak slowly and with short, simple sentences. B. The client may already recognize the anxiety and is attempting to deal with it. C. Walk with the client as he paces. This gives support while he uses anxiety-generated energy. D. Increasing the level of supervision may be appropriate after he stops pacing. It would minimize self-injury and/or loss of control. Question 589. A 14-year-old teenager is demonstrating behavior indicative of an obsessive-compulsive disorder. She is obsessed with her appearance. She will not leave her room until her hair, clothes, and makeup are perfect. She always dresses immaculately. Recently, she expressed disgust over her appearance after she gained 5 pounds. After observing a marked weight loss over a 2-week period, her mother suspects that she is experiencing bulimia. She eats everything on her plate, then runs to the bathroom. In interviewing the teenager, she discusses in great detail all of the events leading to her bulimia, but not her feelings. What defense mechanism is she using? A. Dissociation. B. Intellectualization. C. Rationalization. D. Displacement. Answer: B. Intellectualization. Explanation: A. Dissociation is separating a group of mental processes from consciousness or identity, such as multiple personalities. That is not evident in this situation. B. Intellectualization is excessive use of reasoning, logic, or words usually without experiencing associated feelings. This is the defense mechanism that this client is using. C. Rationalization is giving a socially acceptable reason for behavior rather than the actual reason. She is discussing events, not reasons. D. Displacement is a shift of emotion associated with an anxiety-producing person, object, or situation to a less threatening object. Question 590. A prima gravida with a blood type A negative is at 28 weeks gestation. Today her physician has ordered a ROGAM injection. Which statement by the client demonstrates that more teaching is needed related to this therapy? A. I'm getting this shot so that my baby won't develop antibodies against my blood, right? B. I understand that if my baby is Rh positive I'll be getting another one of these injections. C. This shot should help to protect me in future pregnancies if this baby is Rh positive, like my husband. D. This shot will prevent me from becoming sensitized to Rh positive blood. Answer: A. I'm getting this shot so that my baby won't develop antibodies against my blood, right? Explanation: A. ROGAM is given to Rh-negative mothers to prevent the maternal Rh immune response to fetal Rh-positive antigens. B. If the infant is Rh positive, the mother will receive another dose post-delivery to prevent maternal sensitization. C. Prevention of maternal sensitization will protect future pregnancies because the mother's blood will be free of antibodies against her fetus. D. ROGAM prevents maternal sensitization to Rh-positive blood. Question 591. As soon as a child has been diagnosed as hearing impaired, special education should begin. Which of the following special education tasks is the most difficult for a severely hearing impaired child? A. Auditory training. B. Speech. C. Lip reading. D. Signing. Answer: B. Speech. Explanation: A. With the slight and mild hard of hearing, auditory training is beneficial. B. Speech is the most difficult task because it is learned by visual and auditory stimulation, imitation, and reinforcement. C. D. Lip reading and signing are aimed at establishing communicative skills, but they are learned more easily by visual stimulation. Question 592. A male client has burns over 90% of his body after an automobile accident resulting in a fire. He was trapped inside the auto and pulled out by a bystander. After several months in the hospital and over 20 surgeries, discharge planning has begun. Throughout his hospitalization, the nursing staff has been aware of psychological changes the client faces after burns over a large portion of his body resulting in disfigurement. The nursing staff can best foster the client's self-esteem by A. Adhering to a strict schedule of diet, exercise, and wound care. B. Allowing him to go to physical therapy for whirlpool treatment when other clients were not in physical therapy. C. Following a standardized plan of care for burn clients formulated by a world-renowned burn center. D. Allowing him to plan, assist in, and perform his own care whenever possible. Answer: D. Allowing him to plan, assist in, and perform his own care whenever possible. Explanation: A regimented schedule, allowing no flexibility, will not foster the client's self-esteem. B. Isolating the client may only enhance his feelings of social isolation due to his disfigurement. C. Standardized care plans must be personalized and adapted to each client's situation. D. Allowing the client control over his care will foster his self-esteem and prepare him for life outside of the hospital. Question 593. A male client tells his nurse that he has had an ulcer in the past and is afraid it is flaring up again. The nurse begins to ask him specific questions about his symptoms. The nurse knows that a symptom that might indicate a serious complication of an ulcer is A. Pain in the middle of the night. B. A bowel movement every 3 to 5 days. C. Melena. D. Episodes of nausea and vomiting. Answer: C. Melena. Explanation: A. Clients with ulcers generally experience abdominal pain. It is common to have pain in the early morning hours with an ulcer. B. Constipation is not a symptom associated with ulcers and would indicate a need to look at other factors. C. Melena is blood in the stools. This could indicate a slow bleeding ulcer, which could result in significant amounts of blood loss over time. D. Nausea and vomiting may be present as a result of the ulcer, especially if it is a gastric ulcer. This does not indicate an immediate life-threatening complication. Question 594. An 8-year-old boy has been diagnosed with hemophilia. Which of the following diagnostic blood studies is characteristically abnormal in this disorder? A. Partial thromboplastin time. B. Platelet count. C. Complete blood count. D. Bleeding time. Answer: A. Partial thromboplastin time. Explanation: A. Partial thromboplastic time measures activity of thromboplastin, which depends on the intrinsic clotting factors deficient in children who are hemophiliacs. B. Platelet counts are normal in hemophilia. C. Hemophilia does not affect the complete blood count. D. Bleeding times are normal in hemophiliacs. They measure the time interval for the bleeding from small superficial wounds to cease. Question 595. A 4-week-old infant is admitted to the emergency room in respiratory distress. Which of the following statements indicates the nurse's knowledge of the anatomy of the respiratory system in pediatric clients? A. The diameter of the trachea is much smaller in children than in adults. B. The tongue is proportionally smaller in children than in adults. C. The pediatric airway is more rigid than that of the adults. D. The length of the pediatric airway is longer in children than in adults. Answer: A. The diameter of the trachea is much smaller in children than in adults. Explanation: A. The airway in children is much smaller than it is in adults. The diameter of the trachea in the newborn is 4 mm and that of the adult is 20 mm. A small change in the diameter of the airway can make a major difference in the pediatric client. B. The tongue is proportionally larger in children and fills most of the oral cavity, thereby decreasing airspace. C. The entire pediatric airway is elastic. Elasticity diminishes with age, however. D. The distances between respiratory structures are shorter than that of adults, and therefore organisms are able to move more rapidly down the throat, leading to more extensive respiratory involvement. Question 596. A 48-hour-old male infant is ordered to have phototherapy. When his mother questions the nurse about its purpose, the nurse explains that phototherapy A. Prevents the development of ophthalmia neonatorum. B. Assists the baby's clotting mechanism. C. Breaks down bilirubin in the skin into substances that can be excreted in stool or urine. D. Increases levels of unconjugated bilirubin, thereby preventing kernicterus, brain damage. Answer: C. Breaks down bilirubin in the skin into substances that can be excreted in stool or urine. Explanation: A. The installation of erythromycin ophthalmic preparation, not phototherapy, prevents ophthalmia neonatorum. B. The administration of vitamin K, aquamephaton, assists the infant's clotting mechanism. C. Excessive bilirubin accumulates when the infant's liver cannot handle the increased load caused by the breakdown of red blood cells postnatally. This excessive bilirubin seeps out of the blood and into the tissues, staining them yellow. Phototherapy accelerates the removal of bilirubin from the skin by breaking it down into substances that can be excreted in stool or urine. D. Phototherapy decreases levels of unconjugated bilirubin, thereby preventing kernicterus. Question 597. A female client is exhibiting signs of respiratory distress. Which of the following signs indicate a possible pneumothorax? A. Crackles or rales on the affected side. B. Bradypnea and bradycardia. C. Shortness of breath and sharp pain on the affected side. D. Increased breath sounds on the affected side. Answer: C. Shortness of breath and sharp pain on the affected side. Explanation: A. With a pneumothorax, air occupies the pleural space. Crackles or rales are heard with increased fluid or secretions and would not be present with air in the space. B. With a pneumothorax, the client would experience tachypnea and tachycardia to compensate for the decrease in oxygenation. C. Symptoms of pneumothorax include shortness of breath, sharp pain on the affected side with movement or coughing, asymmetrical chest expansion, and diminished or absent breath sounds on the affected side. D. With a pneumothorax, breath sounds would be decreased on the affected side, indicates air in the pleural space. Question 598. In an interview for suspected child abuse, the child's mother openly discusses her feelings. She feels her husband is too aggressive in disciplining their child. The child's father states, being a school custodian, I see kids every day that are bad because they did not get enough discipline at home. That will not happen to our child. Based on this remark, the nurse would make the following nursing diagnosis. A. Fear related to retaliation by the father. B. Actual injury related to poor impulse control by the father. C. Ineffective coping. D. Altered family process related to physical abuse. Answer: D. Altered family process related to physical abuse. Explanation: A. There is no evidence of fear as the child is unable to communicate. B. There is actual injury, but the parents have not yet admitted causing the child's injuries. C. This diagnosis is incomplete. There is no specific ineffective coping behavior identified in this nursing diagnosis. D. Altered family process best describes the family dynamics in this situation. The parents have admitted severe disciplinary action. Question 599. A female client at 36 weeks gestation is experiencing preterm labor. Her physician has prescribed 2 doses of betamethasone 12 mg IMQ-24H. The nurse explains that she is receiving this drug to A. Treat fetal respiratory distress syndrome. B. Prevent uterine infection. C. Promote fetal lung maturation. D. Increase uteroplacental circulation. Answer: C. Promote fetal lung maturation. Explanation: A. Respiratory distress syndrome occurs in the newborn, not the fetus. It may be treated postnatally with surfactant therapy. B. Betamethasone is a corticosteroid, not an anti-infective drug, therefore, its use would not prevent uterine infection. C. Betamethasone binds with glucocorticoid receptors in alveolar cells to increase production of surfactant, thus increasing lung maturity in the preterm fetus. D. Betamethasone does not affect uteroplacental circulatory exchange. Question 600. A female client has just died. Her family is requesting that all nursing staff leave the room. The family's religious leader has arrived and is ready to conduct a ceremony for the deceased in the room, requesting that only family members be present. The nurse assigned to the client should perform the appropriate nursing action, which might include: A. Inform the family that it is the hospital's policy not to conduct religious ceremonies in client rooms. B. Refuse to leave the room because the client's body is entrusted in the nurse's care until it can be brought to the morgue. C. Tell the family that they may conduct their ceremony in the client's room, however, the nurse must attend. D. Respect the client's family's wishes. Answer: D. Respect the client's family's wishes. Explanation: A. It is rare that a hospital has a specific policy addressing this particular issue. If the statement is true, the nurse should show evidence of the policy to the family and suggest alternatives, such as the hospital chapel. B. Refusal to leave the room demonstrates a lack of understanding related to the family's need to grieve in their own manner. C. The nurse should leave the room and allow the family privacy in their grief. D. The family's wish to conduct a religious ceremony in the client's room is part of the grief process. The request is based on specific cultural and religious differences dictating social customs. Question 601. A female client has been recently diagnosed as bipolar. She has taken lithium for the past several weeks to control mania. What must be included in client education regarding lithium toxicity? A. Maintain a normal diet, however, limit salt intake to no more than 3 g/day. B. Take lithium between meals to increase absorption. C. Withhold lithium if experiencing diarrhea, vomiting, or diaphoresis. D. For pain or fever, avoid aspirin or acetaminophen, Tylenol. Nonsteroidal anti-inflammatory drugs are preferred. Answer: C. Withhold lithium if experiencing diarrhea, vomiting, or diaphoresis. Explanation: A. The client should maintain a normal diet including normal salt intake. A low-sodium diet can cause lithium retention, leading to toxicity. B. Lithium must be taken with meals because it is irritating to the gastric mucosa. C. Diarrhea, vomiting, or diaphoresis can cause dehydration, which will increase lithium blood levels. If these symptoms occur, the nurse should instruct the client to withhold lithium. D. Lithium is not to be taken with over-the-counter drugs without specific instruction. Some drugs raise lithium levels, whereas others lower lithium levels. Question 602. A 1-year-old child is to receive an IM injection ordered by his pediatrician. He has fallen asleep in his mother's arms when the nurse approaches. Which approach is most appropriate at this time? A. Give the injection in the vastus lateralis site before the child awakens. B. Awaken the child first and give the injection in the ventrogluteal site. C. Awaken the child first and give the injection in the dorsogluteal site. D. Ask the mother to place the child on the examination table and leave the room, and then give the injection in an appropriate site. Answer: B. Awaken the child first and give the injection in the ventrogluteal site. Explanation: A. If awakened first, the child will know that nothing painful will be done without the child being alerted. B. The ventrogluteal site is a safe site for children because it is a large muscle free of major nerves and blood vessels. C. The dorsogluteal site is not recommended in children who have not been walking for at least 1 year because the muscle is not fully developed. D. The parent will be able to offer support and comfort during and after the injection. Question 603. A male client is admitted to the medical surgical unit from the emergency room with a diagnosis of acute pancreatitis. The nurse performs the admission nursing assessment. He is NPO with 4 fluids infusing at 100 milliliters per hour. He is experiencing excruciating abdominal pain. Based on an analysis of these data, which nursing diagnosis would receive the highest priority? A. Pain related to stimulation of nerve endings associated with obstruction of the pancreatic tract. B. Fluid volume deficit related to vomiting and nasogastric tube drainage. C. Knowledge deficit related to treatment regimen. D. Altered nutrition, less than body requirements, related to inadequate intake associated with current anorexia, nausea, vomiting, and digestive enzyme loss. Answer: A. Pain related to stimulation of nerve endings associated with obstruction of the pancreatic tract. Explanation: A. Relief of pain is the primary goal of nursing intervention because this client is experiencing acute pain. B. Fluid volume deficit is being treated with 4 fluid replacement. C. Knowledge deficit will not be addressed at this time because a client in acute pain is not ready to learn. D. Alteration in nutrition is the third priority after relief of pain and fluid volume deficit. Question 604. A 24-year-old male client is admitted with a diagnosis of sickle cell anemia. The nurse discusses his disease with him and emphasizes the following information. A. He should monitor his sputum, stools, and urine for signs of bleeding. B. His daily diet should include a large amount of fluid. C. He should not be concerned about having to fly on a commuter airplane on a weekly basis. D. He should not worry about having children because this disease is passed on only by female carriers. Answer: B. His daily diet should include a large amount of fluid. Explanation: A. Bleeding is not a symptom of sickle cell anemia or sickle cell crisis. B. Decreased blood viscosity leads to sickling of red blood cells. Increased fluid intake maintains adequate circulating blood volume and decreases the chance of sickling. C. Hypoxia leads to sickling of cells. Flying in non-pressurized planes places the client in a situation of low O2 tension, which can lead to sickling. D. Male and female clients with sickle cell disease can pass the trait on to their offspring. Therefore, this client should receive genetic counseling prior to having children. Question 605. A male client has been an insulin-dependent diabetic for approximately 30 years. He frequently indulges in high-sugar foods and forgets to take his insulin. He has not experienced acute diabetic emergencies over the years but is now beginning to demonstrate symptoms of diabetic peripheral neuropathy. This distresses him because dancing is one of his favorite pastimes. He decides to question his wife's home health nurse about diabetic peripheral neuropathy. The nurse points out his non-compliance to his diabetic diet and insulin regimen. The client answers the nurse, "It has been my experience that the diabetic diet is very difficult to follow. As far as the insulin, isn't a fellow allowed to forget now and then?" The client's actions and response best demonstrate: A. Depression. B. Anger. C. Denial. D. Bargaining. Answer: C. Denial. Explanation: A. Depression may be an underlying feature, but it is not evident from limited data presented here. B. Anger is not exhibited in his response. C. Denial is evident in the client's actions. Through the years, he has had a casual approach to his illness. He only becomes concerned when bodily changes affect his present lifestyle, when in fact he should have been concerned all along. His verbal response also reflects denial. D. There is no evidence of bargaining in the client's actions or verbal response. Question 606. For the past several months, an elderly female client with Alzheimer's disease has experienced paranoia, hallucinations, and aggressive, disruptive behavior. The family is utilizing haloperidol as needed to control her behavior. On nursing assessment, you note that the client demonstrates involuntary movements of the tongue and fingers. This may most likely indicate A. Tardive dyskinesia, which may be a side effect of antipsychotic medication. B. Early symptoms of Parkinson's disease. C. A more advanced stage of Alzheimer's disease than previously experienced by the client. D. The need to change her medication from haloperidol to another antipsychotic drug to lessen symptoms. Answer: A. Tardive dyskinesia, which may be a side effect of antipsychotic medication. Explanation: A. Tardive dyskinesia is a common side effect of antipsychotic medications such as haloperidol. Discontinuing the medication can alleviate symptoms. B. Although mild tremors are an early sign of Parkinson's disease, haloperidol must be discontinued first and the client further evaluated. C. These symptoms do not necessarily indicate a more advanced stage of Alzheimer's disease. D. Most antipsychotic drugs are chemically similar and will produce the same side effects. Question 607. During the admitting mental health assessment, a client demonstrates involuntary muscular activity. He has a marked facial tic around the mouth that is distracting to the nurse during the interview. The nurse recognizes the behavior and documents it as A. Dyskinesia. B. Akathisia. C. Echopraxia. D. Echolalia. Answer: A. Dyskinesia. Explanation: A. The client is demonstrating dyskinesia, which is involuntary muscular activity, such as tic, spasm, or myoclonus. B. Akathisia is regular rhythmic movements usually of the lower limbs, such as constant motor restlessness. C. Echopraxia is mimicking the movements of another person. D. Echolalia is mimicking the speech of another person. Question 608. A client is receiving peritoneal dialysis. He has been taught to warm the dialyzing fluid prior to instilling it because a warmed solution helps keep the body temperature maintained within a normal range during installation. B. Warmed solution helps dilate the peritoneal blood vessels. C. Warmed solution decreases the risk of peritoneal infection. D. Warmed solution promotes a relaxed abdominal muscle. Answer: B. Warmed solution helps dilate the peritoneal blood vessels. Explanation: A. Instilling a cool solution does not significantly lower the body temperature during peritoneal dialysis. B. Warmed solution does help dilate the peritoneal blood vessels, facilitating the exchange of fluids. C. Warming the dialysate does not decrease the risk of peritoneal infection. Sterile technique decreases this risk. D. Relaxing the abdominal muscles does not facilitate peritoneal dialysis. Question 609. A client is dilated 8 centimeters and entering the transition phase of labor. Common behaviors of the laboring woman during transition are A. Frustration, vague in communication. B. Seriousness, some difficulty following directions. C. Calmness, follows directions easily. D. Excitement, openness to instructions. Answer: A. Frustration, vague in communication. Explanation: A. During the transition phase, the mother may become frustrated and unclear in her communication owing to severe pain and fear of loss of control. B. These behaviors are common in the active phase of labor. C. These behavioral clues are seen in the latent phase of labor. D. These characteristics are observed in the latent phase of labor. Question 610. A 6-year-old girl has been diagnosed with a urinary tract infection secondary to vesicoureteral reflux. Which statement by her mother indicates a need for further teaching? A. I have taught her to wipe from front to back after urinating. B. I make sure she drinks plenty of fluids every day. C. She enjoys wearing nylon panties, but I make her change them every day. D. She tries to empty her bladder completely after she urinates, like I told her. Answer: C. She enjoys wearing nylon panties, but I make her change them every day. Explanation: A. Wiping from front to back is wiping from an area of lesser contamination, urethra, to an area of greater contamination, rectum. B. Generous fluid intake reduces the concentration of urine. C. Cotton is a natural, absorbent fabric. Nylon often predisposes the client to urinary tract infections. Dark, warm, moist areas are excellent media for bacterial growth. D. With vesicoureteral reflux, urine refluxes into the ureters during voiding and then returns to the bladder, residual, which becomes a source for future infection. Question 611. The physician has ordered that ampicillin 250 mg 4 be given over 30 minutes. The medication is diluted as recommended in 10 ml in the volume control chamber of a set that has a tubing of 12 ml. Which nursing measure is most accurate considering these facts? A. Infuse volume at 44 ml per hour. B. Infuse volume at 22 ml per hour. C. Infuse volume at 10 ml per hour. D. Infuse volume at 30 ml per hour. Answer: A. Infuse volume at 44 ml per hour. Explanation: A. The volume to be infused should be diluted medication volume added to the volume control chamber, 10 ml, plus the tubing volume, 12 ml. The general formula for calculating 4 medications for children is rate equals volume to be infused x administration set drop factor, microdrop, 60 gtts/min. Desired time to infuse in minutes rate equals 10 plus 12, 22 x 60 30 is equal to 44 ml/hr. B, C, D. These values are incorrect. Question 612. A client has been instructed in how to take her nitroglycerin tablets. The nurse giving her instructions knows the client understands the information when she tells her. A. I should contact my physician if I have headaches after I take this medicine. B. I should keep the tablets in the refrigerator. C. I should call the doctor if 3 doses of the medicine do not relieve my pain. D. I should take these with water but not with milk. Answer: C. I should call the doctor if 3 doses of the medicine do not relieve my pain. Explanation: A. Headaches may occur after taking nitroglycerin because of vasodilation. B. The tablets do not need to be refrigerated. The client should carry them with her. C. The client should contact the physician if repeated doses of nitroglycerin do not relieve the discomfort. D. Nitroglycerin tablets should be dissolved under the tongue, not swallowed. Question 613. A client is pregnant for the 4th time and has had 3 normal vaginal deliveries. She is in active labor and fully dilated. Suddenly she calls, "Nurse, the baby is coming." As the nurse responds to her call, which one of the following observations should the nurse make first? A. Inspect the perineum. B. Time the contractions. C. Prepare a sterile area for delivery. D. Auscultate for fetal heart rate, FHR. Answer: A. Inspect the perineum. Explanation: A. The nurse must assess the labor status to determine if birth is imminent. The nurse may note perineal bulging, crowning, or birth of the head to ascertain labor status. B. Assessing uterine contractions is one intervention to ascertain labor status. Based on the client's cry, it is not the intervention of choice. C. If delivery of the infant is imminent, preparing a clean or sterile area for delivery is appropriate, but labor status must be established, whether delivery is imminent, by perineal assessment. D. Assessing FHR is one intervention to ascertain fetal well-being. Based on the client's cry, this is not the intervention of choice. Question 614. A female client at 36 weeks gestation has been treated successfully for premature labor for 4 weeks. She has begun having uterine contractions today and has been admitted to the labor and delivery suite. Her amniocentesis results reveal a lecithin/sphingomyelin L/S ratio of 2 and positive phosphatidylglycerol Pg. These lab values indicate A. Placental maturity, B. Suspected chronic asphyxia, C. Cord compression, D. Fetal lung maturity. Answer: D. Fetal lung maturity. Explanation: A. Placental maturity is assessed by a biophysical profile. B. L/S ratio and presence of phosphatidylglycerol are not used to determine fetal asphyxia. A biophysical profile score of 6 may indicate this condition. C. Cord compression is not reflected by the L/S ratio or presence of phosphatidylglycerol. Variable decelerations observed through electronic fetal monitoring could reflect umbilical cord compression. D. An L/S ratio and GT2 and the presence of phosphatidylglycerol in amniotic fluid indicate fetal lung maturity. Question 615. After instructing a female client on circumcision care, the nursery nurse asks her to restate some of the key points covered. Which statement shows that the client will properly care for her son's circumcision? A. I'll make sure I soak the gauze with warm water first, before I take it off each time. B. I'll make sure that I report any drainage around where they operated. C. I'll apply alcohol to the area daily to clean it and prevent any infection. D. I'll keep a close watch on it for a day or 2. Answer: A. I'll make sure I soak the gauze with warm water first, before I take it off each time. Explanation: A. Before petrolatum gauze is removed, it should be soaked with warm water to prevent trauma to adherent tissues. B. A yellow exudate often forms normally over the surgical site. Only if it becomes foul-smelling and purulent would it need to be reported. C. Alcohol should never be used on the site, this would be extremely painful to the infant. D. Special care and observance should continue until the site is completely covered with clean, pink granulation tissue, which could take 710 days. Question 616. A female client decides on hemodialysis. She has an internal vascular access device placed. To ensure patency of the device, the nurse must A. Assess the site for leakage of blood or fluids. B. Auscultate the site for a bruit. C. Assess the site for bruising or hematoma. D. Inspect the site for color, warmth, and sensation. Answer: B. Auscultate the site for a bruit. Explanation: A. This is an internal device. Assessment of the site should include assessing for swelling, pain, warmth, and discoloration. This measure does not assess patency. B. The presence of a bruit indicates good blood flow through the device. C. The nurse should inspect the site for bruising or hematoma, however, this measure does not assure patency of the device. D. The nurse should inspect the vascular access site frequently for signs of infection. However, this does not assure patency. Question 617. When interviewing parents who are suspected of child abuse, the nurse would use which of the following interview techniques? A. Be direct, honest, and attentive. B. Approach them in the emergency room as soon as you suspect abuse to clear the air right away. C. Ask the parents what they could have done differently to prevent this from happening to the child. D. After the interview, call Child Protective Services. Answer: A. Be direct, honest, and attentive. Explanation: A. The nurse must be honest, direct, professional, and attentive in her interview to gain the parents' trust. B. The nurse should approach the parents in private, away from the child. C. Asking them to relive and evaluate the situation may be looked at as placing blame on the parents for the child's accident. At this point, the parents may get defensive and stop communicating. D. Although you may call Child Protective Services, the nurse should inform the parents of their responsibility to do this and explain the process to them. Question 618. An 11-month-old infant is admitted with a possible diagnosis of pyloric stenosis. Which of describes the characteristic clinical manifestations of pyloric stenosis? A. Pain, especially when eating. B. Poor appetite and sucking reflex. C. Increased frequency and quantity of stools. D. Palpable olive-shaped mass in the epigastrium just right of the umbilical cord. Answer: D. Palpable olive-shaped mass in the epigastrium just right of the umbilical cord. Explanation: A. There is no evidence of pain in infants with pyloric stenosis whether eating or not. B. There are both good appetite and feeding habits in these children. C. Because of regurgitation, there is usually decreased frequency and quantity of stools and also signs of dehydration and weight loss. D. Along with upper abdominal distension, there is a characteristic palpable olive-shaped mass located to the right of the umbilicus. Question 619. A female client is anticipating a visit with her parents over the Thanksgiving holidays. She has recently begun experiencing periods of extreme shortness of breath, which her physician has labeled as panic attacks. Which of the following statements by the nurse would enhance therapeutic communication? A. Why do you feel this way? B. Tell me about your dislike for your parents. C. Don't worry, everything will be all right on your visit with your parents. D. Perhaps you and I can discover what produces your anxiety. Answer: D. Perhaps you and I can discover what produces your anxiety. Explanation: A. Asking the client to provide an explanation for her feelings is often intimidating. B. This response is probing and may make the client feel used and valued only for the information she can provide. C. This underrates the client's feelings and belittles her concerns. It may cause the client to stop sharing feelings for fear that they will be ridiculed. D. The emphasis is on working with the client. It shows that there is hope for change through collaboration. Question 620. An alcoholic client who is completing the inpatient segment of a substance abuse program was placed on disulfiram, antabuse, drug therapy. What should the nurse include in the discharge instructions? A. If disulfiram is taken and alcohol ingested, the client experiences nausea, vomiting and elevated blood pressure. B. Disulfiram is most effective when prescribed as late as possible in a recovery program. C. Disulfiram works on the desensitization principle. D. The effects of disulfiram can be triggered by alcohol 5 days to 2 weeks after the drug is discontinued. Answer: D. The effects of disulfiram can be triggered by alcohol 5 days to 2 weeks after the drug is discontinued. Explanation: A. When alcohol is ingested with disulfiram therapy, the client experiences nausea, vomiting, and a potentially serious drop in blood pressure. B. Disulfiram is most successful when used early in the recovery process while the individual makes major lifestyle changes necessary for long-term recovery. C. Disulfiram works on the classical conditioning principle. D. The effects of disulfiram can be felt when alcohol is ingested 12 weeks after disulfiram is discontinued. Question 621. A 19-year-old prima gravida is admitted to the labor and delivery suite of the hospital. Her husband is accompanying her. The couple tells the nurse that this is the first hospital admission for her. The client's vaginal exam indicates she is 3 centimeters dilated, 80% effaced, and at _0 station. Based on the vaginal exam, she is in A. Stage 2, latent phase. B. Stage 1, active phase. C. Stage 3, transition phase. D. Stage 1, latent phase. Answer: D. Stage 1, latent phase. Explanation: A. The second stage of labor is from full cervical dilation through birth of the baby. The 3 phases of this stage include latency or resting, descent, and final transition. The client is less than fully dilated, so she is not in stage 2. B. The first stage of labor begins with regular uterine contractions and continues until the woman is 10 centimeters dilated. The 3 phases of this stage include the early or latent phase, 3 centimeters, the active phase, 47 centimeters, and the transitional phase, 710 centimeters. The client is NLT, 4 cm dilated, so she is in the latent phase of the first stage of labor. C. The third stage of labor is from the birth of the baby until the delivery of the placenta. The client is less than fully dilated. D. The first stage of labor begins with regular uterine contractions and continues until the woman is 10 centimeters dilated. The 3 phases of this stage include the early or latent phase, 3 centimeters, the active phase, 47 centimeters, and the transitional phase, 710 centimeters. The client is NLT, 4 cm dilated, so she is in the latent phase of the first stage of labor. Question 622. An infant weighing 15 pounds has just been treated for severe diarrhea in the hospital. Discharge instructions by the nurse will include maintenance fluid requirements for the pediatric client. Indicates the nurse's understanding of normal fluid requirements for this infant. A. 240 milliliters per day. B. 680 milliliters per day. C. 330 milliliters per day. D. 960 milliliters per day. Answer: B. 680 milliliters per day. Explanation: A, C, D. These answers are incorrect. B. Normal fluid requirement for this pediatric client is based on the fact that 0-10 kg of weight equals 100 milliliters per kilogram per day. This infant weighs 15 pounds, 6.8 kilograms. Thus, 100 milliliters x 6.8 is equal to 680 ml/day. Question 623. A male client has heart failure. He has been instructed to gradually increase his activities. Which signs and symptoms of worsening heart failure should the nurse tell him to watch for that would indicate a need for him to lower his activity level? A. Pain in his legs when he walks. B. Thirst, weight loss, and polyuria. C. Drowsiness and lethargy after his activities. D. Weight gain, edema in his lower extremities, and shortness of breath. Answer: D. Weight gain, edema in his lower extremities, and shortness of breath. Explanation: A. Pain in the legs could be indicative of doing too much too quickly, but not of worsening heart failure. The client should be cautioned to increase his activity slowly. B. Thirst, weight loss, and frequent urination are not indicative of heart failure. The client should report these symptoms to his physician. C. Drowsiness and lethargy are not indicative of worsening heart failure. The client should report these symptoms to his physician. D. All of these symptoms indicate a worsening cardiac condition possibly associated with too much activity. The client's activity level should be evaluated. Question 624. A male client seeks counseling after his wife of 19 years threatened to divorce him. For most of their marriage, he has physically and verbally abused her. When asked about his behavior in the process of the nursing assessment, the client states, "I was mean to my wife because she insists on cooking meals and wearing clothes that I do not like." This defense mechanism is an example of A. Repression, B. Regression, C. Reaction formation, D. Rationalization. Answer: D. Rationalization. Explanation: A. Repression is blocking a desire from conscious expression. The client is conscious of his desires. B. Regression is returning to an earlier form of expression, which is not demonstrated here. C. Reaction formation is acting out the opposite of true feelings. The client felt anger concerning his wife's cooking and acted out his feelings. D. Rationalization is unconsciously falsifying an experience by giving a rational explanation. The client is attempting to justify his behavior by giving an explanation. Question 625. A 7-year-old girl has been diagnosed with juvenile arthritis and has been placed on daily aspirin. Which statement made by the parent indicates a need for further teaching? A. My daughter takes her aspirin with her meals. B. Her gums have been bleeding frequently. Maybe she is brushing too hard. C. I give her aspirin on a regular schedule every day. D. One sign of aspirin toxicity can be ringing in the ears. Answer: B. Her gums have been bleeding frequently. Maybe she is brushing too hard. Explanation: A. Aspirin should not be given on an empty stomach because it is irritating to the mucosa. B. Bleeding from decreased clotting capacity may be caused by aspirin toxicity. C. A regular schedule of aspirin administration is important to maintain a satisfactory drug level in the body. D. Aspirin toxicity may affect cranial nerve 8, leading to tinnitus, ringing in the ears. Question 626. A murmur has been discovered during the routine physical examination of a 1-year-old child. The parent is extremely concerned about this diagnosis. Which of the following explanations by the nurse indicates understanding of this dysfunction? A. The blood shifts from the right to the left atrium. B. Surgical closure by suture or patch is recommended before school age. C. Most atrial septal defects close spontaneously. D. The child can be treated medically with antibiotics to prevent bacterial endocarditis. Answer: B. Surgical closure by suture or patch is recommended before school age. Explanation: A. Because the left atrial pressure is greater than right atrial pressure, oxygenated blood flows from the left to the right atria. B. Because of the risk of pulmonary obstructive diseases and congestive heart failure later in life, surgery is usually performed between age 4 and 6 years, with essentially no operative mortality or postoperative complications. C. Many ventricular septal defects close spontaneously, 20–60%, as a result of growth and proliferation of the muscular septum or formation of a membrane across the opening. D. This management is usually recommended with children with mild pulmonary stenosis. Question 627. A 3-year-old child has had symptoms of influenza including fever, productive cough, nausea, vomiting, and sore throat for the past several days. In caring for a young child with symptoms of influenza, the mother must be cautioned about A. Giving aspirin and bismuth subsalicylate, Pepto-Bismol, to treat the symptoms. B. Giving clear liquids too soon. C. Allowing the child to come in contact with other children for 3 days. D. The possibility of pneumonia as a complication. Answer: A. Giving aspirin and bismuth subsalicylate, Pepto-Bismol, to treat the symptoms. Explanation: A. Aspirin should never be given to children with influenza because of the possibility of causing Reyes syndrome. Pepto-Bismol is also classified as a salicylate and should be avoided. B. Depending on the severity of symptoms, the child may be receiving IV therapy or clear liquids. C. The disease has a 13-day incubation period and affected children are most infectious 24 hours before and after the onset of symptoms. D. Although viral pneumonia can be a complication of influenza, this would not be an initial priority. Question 628. A 78-year-old female client has a total hip arthroplasty. Her nurse should know that which of the following is contraindicated? A. Encourage exercises in the unaffected extremities. B. Encourage her to cross and uncross her legs. C. Check neurological and circulatory status of the affected leg hourly. D. Place a trochanter roll along the upper thigh of the affected leg. Answer. B. Encourage her to cross and uncross her legs. Explanation. A. Exercising the unaffected extremities will prevent contractures and emboli. B. Crossing and uncrossing the affected leg after surgery can dislocate the joint. C. Neurological and circulatory status of the affected leg has been compromised by surgery. Hourly checks are needed to monitor the status of the leg. D. A trochanter roll will prevent the upper thigh from rolling outward, increasing the chances of dislocation. Question 629. A primipara is assessed on arrival to the postpartum unit. The nurse finds her uterus to be boggy. The nurse's first action should be to A. Call the physician. B. Assess her vital signs. C. Give the prescribed oxytocic drug. D. Massage her fundus. Answer. D. Massage her fundus. Explanation. A. The nurse should first implement independent and dependent measures to achieve uterine tone before calling the physician. B. Assessment of vital signs will not help to restore uterine atony, which is the priority need. C. Giving a prescribed oxytocic drug would be necessary if uterus did not maintain tone with massage. D. Fundal massage generally restores uterine tone within a few moments and should be attempted first. Question 630. A male client is admitted to the psychiatric unit after experiencing severe depression. He states that he intends to kill himself, but he asks the nurse not to repeat his intentions to other staff members. Which response demonstrates understanding and appropriate action on the part of the nurse? A. I understand you're depressed, but killing yourself is not a reasonable option. B. We need to discuss this further, but right now let's complete these forms. C. Don't do that, you have so much to live for. You have a wonderful wife and children. The client in the next room has no one. D. This is very serious. I do not want any harm to come to you. I will have to report this to the rest of the staff. Answer. D. This is very serious. I do not want any harm to come to you. I will have to report this to the rest of the staff. Explanation. A. To the client, suicide may be a reasonable action and the only one he can cope with at this time. B. This response indicates to the client that his intention to commit suicide is not important to the nurse at this time. C. The client is so depressed that he is not able to see the positive aspects of his life. At no time should the nurse discuss another client's problems in conversation. D. This statement tells the client that the nurse recognizes his problem is of a serious nature and will take all steps necessary to help him. Topic 6. Question set F. Question 631. A 24 hours postpartum client complains of discomfort at the episiotomy site. On assessment, the nurse notes the episiotomy is without signs of infection. To relieve the discomfort, the nurse should first A. Assist her with a sitz bath. B. Administer the prescribed medication for pain. C. Teach her Kegel exercises. D. Apply an ice pack. Answer: A. Assist her with a sitz bath. Explanation: A. Warm, moist heat will promote circulation and provide comfort. A sitz bath should be tried before medication is given. B. Pain medication can be given when other comfort measures such as a sitz bath and topical applications are ineffective. C. Kegel exercises facilitate sitting by decreasing tension on the episiotomy. They will not be effective for pain control or sustained comfort level. D. Ice packs are appropriate to apply in the first 12 hours post-delivery to produce vasoconstriction and to reduce edema to the area. Question 632. A client has been in labor 10 hours and is becoming very tired. She has dilated to 7 centimeters and is at 0 station with the fetus in a right occipito-posterior position. She is complaining of severe backache with each contraction. One comfort measure the nurse can employ is to A. Place her in knee chest position during the contraction. B. Use effleurage during the contraction. C. Apply strong sacral pressure during the contraction. D. Have her push with each contraction. Answer: C. Apply strong sacral pressure during the contraction. Explanation: A. This measure is inappropriate. The knee chest position is employed to take pressure off the cord. B. Effleurage is a comfort measure but not the one that will contribute most to the relief of backache caused by a posterior position. C. Sacral pressure will counteract the pressure created by the position of the fetal head. D. The client is not completely dilated. Pushing is contraindicated until the second stage of labor. Question 633. Medication is administered to a client who has been placed in restraints after a sudden violent episode, and his EPSs subside. Restraints can be removed when A. The physician orders it. B. A therapeutic alliance has been established, and violent behavior subsides. C. The violent behavior subsides, and the client agrees to behave. D. The nurse deems that removal of restraints is necessary. Answer: B. A therapeutic alliance has been established, and violent behavior subsides. Explanation: Order release of restraints, but prior to that, the client must meet criteria for release. B. While the client is still restrained, but after violent behavior has subsided, a therapeutic bridge is built. This alliance encourages dialogue between nurse and client, allowing the client to determine causative factors, feelings prior to loss of control, and adaptive alternatives to violence. C. If the client only agrees to behave after violent behavior subsides, he has developed no insight into cause and effect of violence or his response to stress. D. Removal of restraints occurs only when the client meets the criteria for release, not just because the nurse says it is necessary. Question 634. The nurse explains perineal hygiene self-care postpartum to the client. She should be instructed to A. Wear gloves for the procedure. B. Place and adjust the pad from back to front. C. Cleanse and wipe the perineum from front to back. D. Protect the outer surface of the pad from contamination. Answer: C. Cleanse and wipe the perineum from front to back. Explanation: A. Perineal hygiene is a clean procedure and does not require the client to wear gloves. A care provider should wear gloves to adhere to universal precautions. B. The pad should be applied from front to back to prevent contamination of the birth canal or urinary tract from rectal bacteria. C. Wiping from front to back and discarding the wipe prevents contamination of the urinary tract and birth canal from rectal bacteria. D. The inner surface of the pad should not be touched to maintain asepsis. Question 635. A 2-year-old child is recovering from surgery. Considering growth and development according to Erickson, The nurse identifies which of the following play activities as most appropriate. A. Assembling a puzzle with large pieces. B. Being taken for a wheelchair ride. C. Listening to a story about the Muppets. D. Watching Sesame Street on television. Answer: A. Assembling a puzzle with large pieces. Explanation: A 2-year-old child is in the stage of autonomy, according to Erickson. Assembling a puzzle with large pieces enables her to do it herself. B. A wheelchair ride would probably be fun, but it is not directed toward helping the child to achieve autonomy. C. Listening to a story may be fun and educational, but it is not directed toward helping the child to achieve autonomy. D. Watching television may be a favorite activity, but it does not foster autonomy. Question 636. A 24-year-old woman who is gravida 1 reports, "I can't take iron pills because they make me sick." She continues, "My bowels aren't moving either." In counseling her based on appropriate response would be, "It would be beneficial for you to eat A. Prunes. B. Green leafy vegetables. C. Red meat. D. Eggs." Answer: A. Prunes. Explanation: A. Prunes provide fiber to decrease constipation and are an excellent source of dietary iron, as the prenatal client is not taking her supplemental iron and iron deficiency anemia is common during pregnancy. B. Green leafy vegetables provide a source of fiber and iron, however, prunes are a better source of both. C. Red meat is a good iron source but will not address the constipation problem. D. Eggs are a good iron source but do not address the constipation problem. Question 637. Which of the following symptoms might the nurse observe in a client with a lithium blood level over 2.0? A. Fine hand tremor, headache, mental dullness. B. Vomiting, impaired consciousness, decreased blood pressure. C. Polyuria, polydipsia, edema. D. Gastric irritation, nausea, diarrhea. Answer: B. Vomiting, impaired consciousness, decreased blood pressure. Explanation: A. These symptoms are acute, common, and usually harmless central nervous system side effects of lithium. B. These symptoms of lithium toxicity are usually dose-related. C. These symptoms are acute, common, and usually harmless renal side effects of lithium. D. These symptoms are acute, common, and usually harmless gastrointestinal side effects of lithium. Question 638. A violent client remains in restraints for several hours. Which of the following interventions appropriate while he is in restraints? A. Give fluids if the client requests them. B. Assess skin integrity and circulation of extremities before applying restraints and as they are removed. C. Measure vital signs at least every 4 hours. D. Release restraints every 2 hours for client to exercise. Answer: D. Release restraints every 2 hours for client to exercise. Explanation: A. Fluids, nourishment, should be offered at regular intervals whether the client requests, or refuses, them or not. B. Skin integrity and circulation of the extremities should be checked regularly while the client is restrained, not only before restraints are applied and after they are removed. C. Vital signs should be checked at least every 2 hours. If the client remains agitated in restraints, vital signs should be monitored even more closely, perhaps every 12 hours. D. Restraints should be released every 2 hours for exercise, one extremity at a time, to maintain muscle tone, skin and joint integrity, and circulation. Question 639. A 30-year-old client in the 3rd trimester of her pregnancy asks the nurse for advice about upper respiratory discomforts. She complains of nasal stuffiness and epistaxis, most noticeable on the left side. Which reply by the nurse is correct? A. It sounds as though you are coming down with a bad cold. I'll ask the doctor to prescribe a decongestant for relief of symptoms. B. A good vaporizer will help, avoid the cool air kind. Also, try saline nose drops, and spend less time on your left side. C. These discomforts are all a result of increased blood supply. One of the pregnancy hormones, estrogen, causes them. D. This is most unusual. I'm sure your obstetrician will want you to see an ENT, ear, nose, throat, specialist. Answer: C. These discomforts are all a result of increased blood supply. One of the pregnancy hormones, estrogen, causes them. Explanation: A. Decongestants may exaggerate the nasal stuffiness associated with pregnancy. Judicious use of decongestants and nasal sprays is advocated during pregnancy. B. Cool air vaporizers and saline drops may help to relieve the nasal stuffiness. Positioning on either lateral side does not decrease nasal stuffiness or prevent epistaxis. C. Increased estrogen levels result in nasal mucosa edema with subsequent nasal stuffiness. Estrogen also promotes vasodilation, which contributes to epistaxis. The nurse may recommend cool air vaporizers and saline drops to help with the nasal stuffiness. D. Increased estrogen levels result in nasal mucosa edema with subsequent nasal stuffiness. Estrogen also promotes vasodilation discomforts associated with pregnancy. Question 640. A client who has been diagnosed with anorexia nervosa refuses to eat lunch. The most therapeutic response by the nurse to her refusal is: A. Okay, missing one meal won't hurt. B. You'll have to eat lunch, or we'll force feed you. C. It's not appropriate for you to try to manipulate the staff into granting your wishes. D. We will not allow you to starve yourself. You may choose to eat voluntarily or be fed. Answer: D. We will not allow you to starve yourself. You may choose to eat voluntarily or be fed. Explanation: A. This response reinforces the client's maladaptive behavior, thereby contributing to the client's risk. B. Ultimatums are not therapeutic. C. This comment invites an argument because it puts the client on the defensive and stabs at her self-esteem, which is already compromised. D. Setting limits assures the client that staff has genuine concern for her safety and well-being. Giving her an actual choice will give the client an increased sense of control over her life and avoid an argument or power struggle. Question 641. A client's record from the ED indicates that she overdosed on phenylzine sulfate, Nardil, appropriate at this time? A. High carbohydrate, low cholesterol. B. High protein, high carbohydrate. C. 1G sodium. D. Tyramine free. Answer: D. Tyramine free. Explanation: A. There are no data to support the need for increased carbohydrates or decreased cholesterol in the diet. B. There is no data to support the need for increased protein or increased carbohydrates in the diet. C. There is no assessment or laboratory data indicating that sodium should be restricted in the diet. D. Tyramine is an amino acid activated by MAO in the liver and intestinal wall. It is released as proteins are hydrolyzed through aging, pickling, smoking, or spoilage of foods. When MAO is inhibited, tyramine levels rise, stimulating the adrenergic system to release large amounts of norepinephrine, which can produce a hypertensive crisis. Question 642. A client at 6 months gestation complains of tiredness and dizziness. Her hemoglobin level is 10G/dl, and her hematocrit value is 32%. Her nutritional intake is assessed as sufficient. The most likely diagnosis is: A. Iron deficiency anemia. B. Physiological anemia. C. Fatigue due to stress. D. No problem indicated. Answer: A. Iron deficiency anemia. Explanation: A. This clinical situation is indicative of iron deficiency anemia because the client has inadequate nutritional intake. Her blood volume is increasing faster than her red blood cell volume. Anemia is present in the second trimester when the hemoglobin level is and LT 10.5 and the hematocrit value falls below 35%. She needs increased iron supplements with follow-up. B. The client's values are below levels for physiological anemia. C. The client is fatigued because of a low hemoglobin level. D. Her hemoglobin level is low and will probably decrease even more when the blood volume peaks at 28 weeks. Question 643. A client is admitted to the psychiatric unit after lavage and stabilization in the emergency room for an overdose of antidepressants. This is her third attempt in 2 years. The highest priority intervention at this time is to A. Assess level of consciousness. B. Assess suicide potential. C. Observe for sedation and hypotension. D. Orient to her room and unit rules. Answer: B. Assess suicide potential. Explanation: A. The client was stabilized in the ED and consequently would not be sent to the psychiatric unit if comatose. B. Suicide assessment is always appropriate for clients with a history of previous attempts or depression, because either of these factors places the client at high risk. C. The admission assessment should include observation for sedation and hypotension, but this is not in priority over suicide assessment. D. Orientation to room and unit rules is of low priority at this time. Question 644. A 16-year-old female client is admitted to the hospital because she collapsed at home while exercising with videotaped workout instructions. Her mother reports that she has been obsessed with losing weight and staying slim since cheerleader tryouts 6 months ago, when she lost out to 2 of her best friends. The client is 54 and weighs 92 pounds, which important initial intervention on admission is to A. Obtain an accurate weight. B. Search the client's purse for pills. C. Assess vital signs. D. Assign her to a room with someone her own age. Answer: C. Assess vital signs. Explanation: A. On admission, vital signs are the highest priority. Weight is not a vital sign. B. Belongings are routinely searched on admission to a psychiatric unit, but this search is not a high priority. C. Vital signs are a high priority when working with self-destructive clients. D. Room assignment is of low priority. Question 645. After 7 hours in restraints and a total of 30 mg haloperidol in divided doses, a client complains of stiffness in his neck and his tongue pulling to one side. These likely be relieved by the administration of A. Lorazepam, Ativan. B. Benztropine, Cogentin. C. Thiofixine, Navane. D. Flurazepam, Dalmane. Answer: B. Benztropine, Cogentin. Explanation: A. Lorazepam is an anti-anxiety agent that produces muscle relaxation and inhibits cortical and limbic arousal. It has no action in the basal ganglia of the brain. B. Benztropine acts to reduce EPS by blocking excess CNS cholinergic activity associated with dopamine deficiency in the basal ganglia by displacing acetylcholine at the receptor site. C. Thiofixine is an antipsychotic known to block dopamine in the limbic system, thereby causing EPS. D. Flurazepam is a hypnotic that acts in the limbic system, thalamus, and hypothalamus of the CNS to produce sleep. It has no known action in the basal ganglia. Question 646. A newborn girl's father expresses concern that the newborn does not have good control of her hands and arms. It is important for the father to realize certain neurological patterns that characterize the newborn. A mild hypotonia is expected in the upper extremities. B. Purposeless, uncoordinated movements of the arms are indicative of neurological dysfunction. C. Function progresses in a head-to-toe, proximal distal fashion. D. Asymmetrical movement of the extremities is not unusual and will disappear with maturation of the central nervous system. Answer: C. Function progresses in a head-to-toe, proximal distal fashion. Explanation: A. Term neonates are predominantly in a flexed position with strong active muscle tone that increases. Newborns are slightly hypertonic. B. Neonatal movements may be jerky and uncoordinated as the neonate works against gravity in contrast to the buoyancy of the amniotic fluid. Jerky movements must be differentiated from the tremors of hypoglycemia, hypocalcemia, and neurological dysfunction. C. Growth of the newborn progresses in a cephalocaudal, proximal distal fashion. Knowledge regarding infant development may facilitate parental involvement and infant stimulation. D. Asymmetrical movements of the extremities are indicative of neurological dysfunction. Question 647. Degenerative disorders are attributed to many factors. As a nurse assigned to a convalescent home, one must often educate families about how such conditions occur. Which of the following statements might the nurse need to explore when a daughter tries to explain to her mother what caused her degenerative disorder? A. Some folks believe that aging causes this, mother. B. Perhaps it's the way your parents used those double-bind messages, mother. C. I know some people who are having this problem and they were exposed to chemicals at work, mother. D. It can be caused by lots of things, toxic agents, and even alcohol, mother. Answer: B. Perhaps it's the way your parents used those double-bind messages, mother. Explanation: A. Aging is a factor in the cause of degenerative disorders. B. Double-bind messages may be found in the histories of families of individuals who develop schizophrenia, but they are not related to degenerative disorders. C. Chemicals, toxic agents, in work environments are predisposing factors to degenerative disorders. D. Alcohol causes some degenerative disorders, such as Wernicke syndrome. Question 648. A client at 9 weeks gestation comes for an initial prenatal visit. On assessment, the nurse discovers this is her second pregnancy. Her first pregnancy resulted in a spontaneous abortion. She is 28 years old, in good health, and works full-time as an elementary school teacher. This information alerts the nurse to which of the following? A. An increased risk in maternal adaptation to pregnancy. B. The need for anticipatory guidance regarding the pregnancy. C. The need for teaching regarding family planning. D. An increased risk for subsequent abortions. Answer: B. The need for anticipatory guidance regarding the pregnancy. Explanation: A. D. There are no data to support this. B. Anticipatory guidance and health maintenance is a first-line defense in the promotion of healthy mothers and healthy babies. C. There are no data to support this at this time. This will be a concern later. Question 649. 2 weeks after a client's admission for depression, the physician orders a consult for electroconvulsive therapy, ECT. Which of the following conditions, if present, would be a contraindication for ECT? A. Brain tumor or other space-occupying lesion. B. History of mitral valve prolapse. C. Surgically repaired herniated lumbar disc. D. History of frequent urinary tract infections. Answer: A. Brain tumor or other space-occupying lesion. Explanation: A. A contraindication for ECT is a space-occupying lesion such as a brain tumor. During ECT, intracranial pressure increases. Therefore, ECT would not be prescribed for a client whose intracranial pressure is already elevated. B. Any cardiac dysrhythmias or complications that arise during ECT are usually attributed to the 4 anesthetics used, not to pre-existing cardiac structural conditions. C. Musculoskeletal injuries during ECT are extremely rare because of the 4 use of centrally acting muscle relaxers. D. A history of any kind of infection would not contraindicate the use of ECT. In fact, concurrent treatment of infections with ECT is not uncommon. Question 650. The nurse in the mental health center is instructing a depressed client about the dietary restrictions necessary in taking her medication, which is a monoamine oxidase (MAO) inhibitor. Which of the following is she restricting from the client's diet? A. Cream cheese. B. Fresh fruits. C. Aged cheese. D. Yeast bread. Answer: C. Aged cheese. Explanation: A. Cream cheese does not contain tyramine, which might cause a hypertensive crisis. B. Fresh fruits do not contain tyramine, which might cause a hypertensive crisis. C. Aged or matured cheese combined with a monoamine oxidase predisposes the client to a hypertensive crisis. D. Bread products raised with yeast do not contain tyramine. If you're finding this series helpful, please like, subscribe, and turn on notifications so you never miss the next episode of our complete 862-question NCLEX-RN 2026 practice series.